contains high amounts of a chemical called methyl glyoxal. This is also one of the reasons why we use medical-grade honey in the hospital to help with wound healing. Finally, your mum walks in with a steaming hot bowl of chicken noodle soup. Surely that's not going to work. Wonderful traditional home remedies, they were science-based all along.
But for many conditions, X-rays and MRIs are a necessity for a diagnosis. Today, we're using our pioneering technology to help 64-year-old patient Adrian. He's come to one of our imaging centres to discover more about a troubling problem with his waterworks. Ah, Adrian.
Now we are coming to see a bladder problem and
So how
prostate
bad is it?
enlargement.
How often do you have to go to the toilet?
Invariably, it's in the morning when I've had my first drink, cup of tea. And I've had to go 5-6 times in the hour.
5 times an hour?
Oh, God, yeah. And I've been in, hardly emptied my bladder, and then 10 minutes I'm back in again.
So it's dominating your life?
Oh, yeah, completely. It's always there in the back of your mind, always.
Yorkshireman Adrian has been jet set.
Enjoy doing since I moved to London is cycling around town. It holds so much history, you can't help but be enthralled by everything that's laid out in front of you.
But there's one particular site he's always on the lookout for.
As brilliant as out there, it's shut, isn't it? The issue has become, where do I go to the loo? And it will be there all day. Just thought it'd right itself.
Instead, his symptoms continue to get worse, so Adrian finally sought medical help.
The doctors said I have enlarging of the prostate that comes with age of men.
Benign prostate enlargement affects 50% of men in their 50s and up to 90% in their 80s. The prostate is a small organ situated just beneath the male bladder, and it continues to grow throughout a man's lifetime. A frequent need to pee and a weak stream are common symptoms, but in Adrian's case, he sometimes stops passing urine altogether, forcing him to take immediate action.
So this is the catheter. This is the end where the pee comes out once you've inserted it, and that's the end where you stick it down your urethra, and which is at the end of your old John Thomas, the pleasant.
What are you hoping today will give you?
Yeah, I want to have a look inside and see the distortions that have appeared in my insides, and how it's contributed to all this stress and these problems.
Adrian's doctor is Nick Burfitt, an interventional radiology consultant at St Mary's Hospital in London. He's come to our special imaging centre to help Adrian understand his condition and hopefully recommend a suitable treatment.
Aha.
Hi, Adrian. Kate.
Hi there.
Would you like to come through and we'll take a look at your
Come on,
scans?
let's do it. After you, sir, after you.
Using Adrian's medical scans, we've created an exact virtual replica of his lower body so he can see his problem up close. But first we're going to look at a healthy patient to find out where the prostate is and what it's for.
Right,
Adrian,
now
you got
let's
yourself
see
in
the
the
normal
centre.
scan, a holographic view.
Oh wow.
Here you can see the bladder, testicles, everything.
So what have we got here then, Nick?
So here we have the human body.
Yeah.
We can see the kidneys right here in the middle, and then the ureters, which are the tubes that carry the urine all the way down to the bladder, which is this kind of ball-shaped structure within the pelvis.
It's all very complicated and compact, isn't it?
At the front here we have the testicles, two egg-like structures here. I'm holding in my hands here. So they produce sperm, which go through these tubes here, and they go up into the pelvis, round the back, and they go into the back of the prostate gland, which is this sort of ping pong ball sized gland sitting here below the bladder.
It's fascinating how it's structured.
The prostate gland, which produces part of the fluid that makes up semen, is wrapped right around the urethra. That's the tube that carries the semen and urine from the bladder out of the body.
I feel nervous just standing under this.
And it's here that is the source of Adrian's problems.
Well, we've seen what the prostate, the urinary system should look like.
Normal.
A normal one. Should we see what Adrian's looks like?
My
Do you want to have a look at your own prostate?
My grumpy mate.
Your
So
grumpy
now
mate.
we are going to
Shall we
enlarge
check it
prostate
out?
and
So
how
we
it
have
disturbs the
subject
function
on
of
the left
bladder.
here.
There you go.
We can see the prostate gland in the centre, and then over this side, this is your CT scan.
Is that the bladder?
No,
No.
Is that my prostate?
That is your prostate,
This
Adrian.
here, which looks like the size of the bladder on the previous subject, is actually your prostate gland.
It's an Olympian prostate, isn't it?
It's a shot put, isn't it? What are your thoughts, Adrian? Can you see up inside?
Yeah, no wonder I have trouble.
I mean, if you
Looking at
compare
that.
it by taking a look over here as well.
Yeah. Oh, absolutely. Oh, it's vast, isn't it? It's like a big haggis.
It must be the strangest feeling.
Yeah, it feels even stranger now. Yeah, I've seen it.
Here normal
It
prostate
is.
is about 40 cc, but here we
Wow.
can see about six
So
times
we know
bigger
from taking measurements from
enlarged
the CT
prostate.
scan that on this side it's 25 cubic centimetres, and your prostate gland is 220 cubic centimetres, so almost 10 times the volume.
Oh,
Yeah,
10
that's
times
disturbing,
bigger.
isn't it?
While a normal prostate is about the size of a walnut, Adrian's is the size of a grapefruit.
So why is Adrian's so big? What is his condition?
So the medical name for Adrian's condition is benign prostatic hyperplasia, and what that means is that the tissue, mainly within the central part of the gland, has over a long period continued to grow, expanding the gland significantly.
The exact cause of benign prostatic hyperplasia, or BPH, is unknown, but it could be the result of changes in sex hormones as men age.
This is a